You know, this August, while the Senate was in recess, I was home in Iowa talking and listening to Iowans and showcasing everything our state has to offer to diplomats from across the world. As part of my 12th ambassadors tour, I hosted foreign diplomats from 57 countries on a 5-day tour of Iowa to promote international trade and job-creating export opportunities for Iowa agriculture, manufacturing, and even our service sector. I also spent time of the recess traveling around the state, holding town hall meetings. Now, I finished, for every year I've been in the United States Senate, my annual tradition of holding a constituent meeting in every Iowa county every year. I've made it my practice to keep my town hall meetings a very open forum and allow my constituents to set the agenda with their questions or comments or even criticism. Over the last 6 months, I've seen record turnouts and a great deal of discussion centered around healthcare reform and also fear of too much federal spending. I received a lot of common sense input that I will put to good use at the negotiating tables on a whole lot of issues here in Washington. Now that Congress has returned from our district work period, I continue to work on reform initiatives. There are a number of issues that have already gained a broad bipartisan consensus, including health insurance, making it more affordable and also more accessible. And of course, one of the things that's going to help everybody, slowing down the growth of health care costs. In other words, inflation of health care. The President's speech this week could have significantly improved the chances of tackling these reform initiatives in a bipartisan fashion by clearly stating that the government-run public plan was off the table. His failure to do so has instead left reform in the hands of Democratic power brokers in Congress who overwhelmingly support the government-run plan. The President squandered the opportunity to take a stand for bipartisanship and deliver on the change that he promised during his campaign.